Okay, so this is section part 4, which is the last section here, I believe. We're going to get at problem solutions for sitting, standing transfers, and we're going to talk about transfers. Let's go to this chart. This is just want to show you this chart. We'll be doing this a lot in the lab. There's these two charts we're going to be working off of. This chart here, they're both posted on Canvas. This is solutions for sitting. We talked a lot about the sitting already. This is the new stuff. There's some great ideas and solutions for issues you're going to have with transfers. In particular, sit to stand. When a person's having a hard time standing up, and they can't shift their weight forward. They have weakness in their quads, weakness in their ankles, and maybe even their arms are weak, so they can't push up from their armrests very well. Shows you kind of how to look, what to look for with this, what anatomy is being impacted, what you need to do to get them up out of that chair, and then some techniques, some tips that we'll go through. So just check these out, be familiar with these, so we can kind of jump right into them in lab when we get there. And then the other one is this core progression. This is for those hard to work with patients that are almost bedbound. They really can't get out of bed by themselves. You try to do something on the edge of the bed and they just flop. They can't even hold themselves up and don a blouse without you holding on to them. Very weak core issues, basic low level core issues. Stuff you can do in bed with them. We'll go through this. Stuff you can do at the edge of the bed. And then really basic, simple stuff you can do once you get them standing. So again, it's a core to work your clients through this progression. So those hard to work with clients that are stuck in bed, what do I do with this person? They're so weak. There's a lot you can do still in bed without even getting them up. So there's them, and then those hard to get out of the chair client that just cannot get off that toilet. What can you do to kind of get them where they need to go? Okay, so going back here. This is just a review of the transfers, the levels of assist. We'll go through all this again in the lab, just to remind you, because I know some of you have not done any clinicals yet. Most of you have not done any clinicals yet, and you're going to be getting rehab, a lot of rehab. The school's obviously a big issue with COVID, so you want to go back over that so you feel comfortable with that before you go out there. And just having the patient do as much as they can for themselves. Just look over this to remind yourself how to do the transfers. We're going to get into this. We're going to get into the anatomy, the key anatomy. Have to figure out where this anatomy is. Some of it's unfamiliar with that to us as OTs. This lower body anatomy. How to grade sit to stand. A lot of great ways to grade that. It's just one simple thing, but you could spend just weeks just on working on sit to stand. And we're going to do some NDT facilitated stuff. I would check out this video if you can. It's a cool video. This woman doing some NDT facilitated anterior tilt and then sit to stand. A little more advanced technique with clients that are not totally max dependent. They're starting to get stronger. This is a great way to get them to work harder and you to work less. I'm definitely not an expert at NDT. I can't do it the way she does it exactly, but you can get the general idea of it. It's a great tool to have in your toolbox. You'll be seeing there's a lot of practitioners with degrees of knowledge with NDT. Just these basic core concepts can be very helpful to you when you're trying to move people. And we're also going to do some LSVT movements that I've learned. Can't really call them LSVT, but call them kinetic link movements. They make great tools for getting people from sit to stand again, facilitate that. Your clients having a hard time with that. And then just lastly, we're going to go over the lecture questions, make sure everybody's got those. What is one exercise for forward head, rounded shoulders, excessive anterior tilt, excessive posterior tilt? We went through all of these with Mr. Putin. We didn't do excessive anterior tilt. This is the opposite of excessive posterior tilt. So with excessive anterior tilt, you're coming too far forward. You could do the one where you have them go supine. So they're on their back doing leg lifts, and they're pushing their belly into the mat as they're lifting the legs up. You may have done this to work your rectus abs, to get that six-pack abs. It's a common one people do. So that's one to push them more posteriorly. And that's all listed on those charts. What are the negatives to excessive posterior tilt, flat back? It could really strain those spinal extensors in that area of the low back. Common cause of low back pain, overly strained spinal extensors can also damage the disc, the spinal discs. Which abdominal muscles do we want to engage for ideal posture? This is kind of a tricky question. It depends on whether they have an excessive posterior or anterior tilt. But commonly, they have a collapsed posture. You want to extend their trunk. The obliques, transverse abdominals and oblique muscles are a good one for that. That's what I would say. Which muscles do you want to engage for ideal posture? I would say the transverse and oblique abdominal muscles. How is walking with a flat foot detrimental? I think it talks about, just to double check that. Causing issues with your knees. Going to tilt inward, causes knee pain, definitely foot pain, cause back pain as well. How is walking with flat foot detrimental? I would say knee pain, back pain, foot pain. What is the proper role of the hips when bending over? Bending, flexing. You're flexing the hips. The key part is to really flex your hips when they bend over. What are 3 ways to grade sit to stand for rehab? 3 ways to grade it. You can have them put their good leg, non-effective leg forward, forcing them to use their effective leg more. There's one way. One way is good leg forward when you're sitting. Second way, you can lower the chair, or raise the chair. So you can make it lower to work them harder, higher to make them work less. Thirdly, you can have them push off of an unstable surface. So like a foam cushion or pad, they could go sit to stand pushing off that. There are 2 in-bed exercises clients can do in bed to strengthen their core. You can do a lot of stuff in bed. We'll get right into this in the lab. 2 in-bed exercises are you can do bridges. It's a good one. And you could do planks, modified planks. So modified planks and bridges are 2 good ones you can do. Again, those are right on the chart. That's coming up. Get your quiz, 9-10. Be ready for that. That's on lecture 2, this lecture, weeks 1 and 2. And the exercises, be prepared for that one. And then those are the readings coming up. Okay, so we're all set for this week.